Good afternoon, folks. This is Robert Chappell, Executive Editor at Madison365 with your daily update for Monday, March 29th, 2021. It is Metcalf's Monday. Metcalf's Markets is a fourth-generation, family-owned and operated market with stores at Hilldale and behind Westtown Mall here in Madison, and also over in Wauwatosa at 68th and State. Right now, they are stocked with everything you'll need for an amazing Easter meal coming up on Sunday, including hams and produce from local farms. And because there's still a pandemic and Metcalf's cares about your health, you can order for pickup or delivery at shopmetcalfs.com anytime. And before we get to the news, I just want to also plug one other thing. Black Oxygen today. There's a new episode out featuring Karen Nelson. Angela Russell is the host of that show. The guest today is Karen Nelson, who I know as the Diversity, Equity, and Inclusion Coordinator at the City of Appleton. When we first started, when we launched, really, and we started to look at covering other areas of the state, she was like the person you had to talk to in the Fox Valley if you wanted to do, covering communities of color. She has now, since since January, she's now taken a job at Rogers Behavioral Health as their Director of Equity, Diversity, and Inclusion. And what I did not know about Karen is that she started out life as a chemist and actually created a formula for a hair care product that would work better for Black women's hair, and was basically told no. And it's an interesting story. It's not a good story. It's not a nice story, but it's a story that you should listen to. You should hear. And that is wherever you get podcasts. Apple Podcasts, Stitcher, Spotify, iHeartMedia. Just search for Black Oxygen and it'll come up. Or you can go to our website, madison365.org/Black Oxygen. Give that a listen. So we'll talk through coronavirus numbers today, which are not terrible. We were, last week we expressed some concerns, and those concerns continue to be there. The actual case numbers today are not quite as bad. That is to say, 3,200 new tests today and 296 new cases. So just over 9%. We did see over the weekend, we saw almost 1,000 cases between Saturday and Sunday, which is more than you'd like to see on a weekend. Coming out of the weekend, though, things are lower as usual. The 7-day positive test rate, however, went up yesterday to 2.7%, and it stays at 2.7% today. Remember, we worked so hard for such a long time to get that down below 3.0, and it got all the way down to 2.0, and now it's kind of inching its way back up toward 3.0. Now it's at 2.7. Again, that's the percentage of all tests in the past 7 days that have returned positive results. So we don't love that. We are seeing a significant decrease in deaths, however. Our 7-day average of deaths now is 4. Only 3 reported today. Again, though, remember, Sundays and Mondays have been lower typically. So we'll see how, if there's more reported tomorrow and Wednesday. The other thing I'll mention, these spread in cases. Again, you never want to look at any particular number like in isolation, right? But the spread in cases is kind of okay if we're going down on hospitalizations and in deaths, because what that could mean is somebody who's vaccinated. We'll talk about vaccine. There's good news on vaccines. We'll get to that in a minute. If people get vaccinated, they could still test positive, but they're not going to be very sick. They're not going to be hospitalized. They're not going to die. Right? They can still spread it a little bit. It's less likely. But at some point, we'll start to see some of these positive cases among people who've been vaccinated, which is some people you might think that's a reason to panic that, the vaccine doesn't work. But no. If somebody's vaccinated and tests positive, that just means they're carrying virus. Their body is fighting it off. They're not getting sick. Because, really, at the end of the day, there's all this coronavirus spreading throughout the world and nobody's really getting sick from it. Who cares, right? It becomes a harmless virus. and then it'll eventually go away. So we do want to start looking at hospitalizations again. As these spread numbers start to go up, we want to make sure that hospitalizations stay low. And the thing is that the hospitalizations are kind of moving upward as well, which is not the greatest thing. Now, they're back down again today, but also we'll say don't worry about hospitalizations in terms of overwhelming the hospitals. We're not anywhere close to that. Remember, we were very close to that in November. There were hospitals that were turning people away. There was an alternative care facility in Milwaukee. The hospitals were in really rough shape at the end of 2020. Today, we're not even close to that, but we're going to keep track of hospitalizations as a measure of the severity of the illness. Okay. So right now in Wisconsin, we have 227 people hospitalized, which is a very low number. Problem is, again, we never want to look at any number on its own in isolation. We want to look at trends. That's 24 more people that were hospitalized a week ago. But it's 3 fewer than yesterday. Okay. So again, yesterday we had 230, which was like 37 more than the week before that. So we'll start to, we've kind of, once hospitalizations started to come down, we've kind of not watched them as closely. But I think we're going to start again. As these case numbers start to go back up, we want to see, do hospitalizations correlate with that, or are these like less severe cases, right? Because ideally, we'll be getting older people vaccinated. So even those cases that are positive and haven't been vaccinated are like in younger people who aren't as vulnerable, right? So maybe they won't be as severe. So we're going to start kind of watching the number of cases as well as the severity of the cases, because I think that's important. And it's a level of nuance you're not going to get on the evening news, So we'll try to do that for you. 58 people currently in ICUs, which is only 1 more than a week ago. So that's not too bad. Any questions on this stuff, drop them in the comments. I will do my best to answer them. Now, on the vaccine front, let's talk about that for a second. We have now passed 1 million people fully vaccinated, which is about 17% of the population, of the entire population. Not just the adult eligible population. It's the entire population of Wisconsin. 17.1% are vaccinated, and that is, and that's only reporting 5,700 new vaccinations from yesterday. I'm pretty sure there were more done than that, and they're a little bit slower to report and update the data on the weekends. We have 1.7 million people who've gotten at least 1 dose. So we've actually administered 2.7 million doses. 2.74 million doses to a total of 1.7 million people, which is good, and we're continuing to see average, understanding that weekends are slower. There are fewer reported on the weekends. We're still seeing about 45,000 per day. We want to keep that continuing to go up. If we get to 50,000, 60,000 a day, which it sounds like we're trying to do. Like the federal government is pushing to get more people eligible more quickly. Right. Right now, the state is saying everybody is eligible May 1st. Everybody 16 and older is eligible May 1st. But the federal government is saying actually April 19th. So, the President Biden is saying, okay, that's nice. May 1st. Okay, that's fine. No. April 19th is actually what we're going to say. I don't know if that will actually translate in Wisconsin, or, that's really, or we'll have to wait that 11 days. But then the hard part is getting an appointment. And then the even harder part is getting vaccine into vulnerable communities that have a hard time accessing health systems, right? Folks who don't necessarily have a primary care physician, who don't have a relationship with the healthcare community, who may be undocumented, who are, and therefore afraid to interact with any sort of government authority, right? I mean, if you're undocumented and okay, come to the county health office. That's not going to happen. So that's going to be the next challenge, is to kind of get the low hanging fruit done. All of us that have the privilege to be able to just go into a clinic at any particular time. But then to do that extra legwork to get it to those communities that have less access, less information, maybe language barriers, that's going to be the real challenge to get to 80%, because I don't think we're going to get it's never going to be where we're doing 60,000 a day and it's just going, steady at that same pace. That'll go for a while, but then there's going to be some challenges continuing that all the way down to those sort of neighborhood levels. But I know the state is working on it. They have programs. They're building programs. They're spending money to try to do that sort of outreach that it takes to do that community health work. So here's hoping. Here's hoping that it actually gets done. All right. I think that's everything I have on coronavirus today. I think I got everything. I got all the stats here. Yep. We have there's lots more news to talk about, though, so stay right there. We'll be back right after this. All right, our main feature story this morning has to do with Baraboo Schools. Now, if you have been with us for a couple of years, or if you've been around, you might remember we, along with several other local outlets, kind of broke this story when it happened. This is a prom photo in which, several dozen kids, about half of which are throwing this Nazi salute for some reason. It was a kind of a wild story, and several... it's one of those things that broke at like 4 o'clock in the morning. Excuse me. So I was up trying to get somebody on the phone at 4:30, 5 o'clock in the morning. And I was actually the first reporter in the country to actually talk to the photographer who took that picture, who said it had nothing to do with Nazis at all and whatever. So that photo, the only reason I bring it up is that photo led to kind of a reckoning in the Baraboo School District. And they had lots of listening sessions and pledged to do better and want, all the things that institutions normally do when something like that comes out. And there were other stories that came out of that. I could never get anybody to go on the record to report it, but I heard directly from several Baraboo alumni who said I was a person of color in that school district and it was awful. But, but it's hard to say that out loud in public and be on the record with your name on it. It's a lot of, I couldn't get anybody to talk about it on the record. But anyway, the school district had some issues to deal with, and they have now hired a new superintendent, and his name is Rainey Briggs. He's currently the director of elementary education at Middleton Cross Plains School District. He's from the south side of Madison, and he was a finalist for the superintendent's job in Verona and abruptly withdrew from consideration within a couple of days after being named a finalist. And it's not quite clear why yet, and that's his business. But it might have been that he liked this Baraboo opportunity better. Who knows? But anyway, what this means, and what's interesting is, this is Dave Dahmer, our editor-in-chief, wrote this story, and I really expected him not to talk about the Nazi salute thing, that it was, that he wanted to move forward or, and not lean on that necessarily, but he dug right into it. He said that was that thing that happened a couple years ago. That was a problem. I read about it in Madison365, and now here they are hiring a black superintendent. So it's, he has that in his mind. That his identity is important. He's a black superintendent. He's not a superintendent who happens to be black, right? Which is important. So anyway, that story, it's a good story. Get to know him a little bit. And also I'll note that now Madison, Verona, and Baraboo are all school districts that are led now by black men starting this summer, which is like, it's interesting that in all three cases, it's the first in 2021. But it's remarkable. It's wildly different than any school districts around here would have been when I was in school. And I grew up around here. And they were all led by white men, or occasionally a white woman. But to have three of the sort of the largest school districts in the area and most diverse, led by black men, is quite remarkable, and it will be interesting to see how that goes forward. The other thing I'll mention about Baraboo, Verona, you have a lot of black and a lot of Latino kids from Pittsburgh. Obviously, Madison's very diverse as a school district, but in Baraboo especially, there's a lot of Ho-Chunk students. So there's a whole other layer of challenge for the diversity there. Also in the news today, Wisconsin Watch has a really good story out, which we put on our site at Madison365.org, that undocumented immigrants and immigrants of all kinds are eligible for rent assistance. There's the Governor Evers is putting federal money into this rental assistance program, $322 million worth to help people just, pay the rent and not get evicted. And immigration status doesn't matter for this program, but there are lots of nonprofit organizations who are administering this program and who might be unintentionally discouraging immigrants from applying, because a lot of these nonprofits, they're working at the local level. It's not that you don't apply to the state for this money. You apply at a local nonprofit, which then takes the state money and helps you out. But a lot of those organizations ask for a social security number, which will lead a undocumented immigrant to not even fill out the application. Right? So Wisconsin Watch has this story, and along with the story is a sort of a Q&A and a bunch of contact information for various rental assistance agencies around the state who are helping to administer this program. So not only can you learn about the immigration piece and about the program itself, but if you are in trouble and you need some help with rent, which a lot of people do right now, no shame in that at this moment, ever. There's really no shame in it ever. But certainly if you're having trouble paying the rent, you're certainly even less alone than usual these days. So there's some links and some phone numbers to help you out. And to find the assistance that you might need. In sports today, forward Madison has signed Carlos Gomez. He's a winger and a midfielder. He's a Spaniard. He's from Madrid, and he's currently in Spain. And he played for Greenville Triumph in the past 2 seasons, won a league championship with them last year, even though he was injured for half the season last year, so he didn't play that much. He had a shoulder injury, but he's back at full health, and he is now signed with Madison. He actually had options to play in Europe and decided to come here because he remembers playing for Greenville at Bree Stevens Field in front of our boisterous and noisy fans, and wants to play for those fans now. So that should be he should be an exciting addition to the club. That is the news for today. I appreciate you sticking with us. And I hope you had a wonderful weekend. And it's a beautiful day. It's a beautiful evening. I hope you can get out. I'm going to be hanging out at the park while my son has his first soccer practice in a very, very long time, which is very exciting. I don't know how in the world he's going to try to play soccer with a mask on, but he's going to do it. That's what they have to do. So he's excited. I'm excited. And we'll be back tomorrow. Until then, take care. Have a great evening.
This is 365 Media.